Hi, everyone. I am so thrilled to be speaking with Dr. Rajani Katta. She is a board certified dermatologist and practicing in Houston, Texas. And it's her passion about achieving healthier skin through foods, skincare, and lifestyle. Welcome, Dr. Katta. It's such a pleasure.
Oh, I'm so honored to be here.
So, the difference between pre and pro, let's go with that first. What is the
Yeah,
difference?
that's a really important distinction.
Mhm.
So, when you hear prebiotics, those are substances that can beneficially promote the growth of good gut microbes. And an example that's actually been studied in randomized controlled trials is galacto-oligosaccharides. So that's an example of a prebiotic that can help grow good gut microbes. And if you think about prebiotics in your diet, the big one is fiber,
Yeah.
and that's fiber that's found in fruits, in vegetables, in oats. Those are all examples of prebiotic foods. Onions, garlic, there's a lot of them. So that's prebiotics. And then probiotics are live active cultures of beneficial microbes. So, and it's unclear, how many of those survive when you consume either foods or supplements that contain probiotics,
Fair.
but they are beneficial microbes. And if you think about foods, live active cultures, this is your yogurt, your kefir, your miso, your sauerkraut. These are your fermented foods. And I think it's fascinating that every single culture seems to have fermented foods in the diet, and they are almost universally known as a healthy food. So I've talked to people. I met this young woman this colleague from Czechoslovakia, and she talked about how her grandparents were like, you need to eat your sauerkraut. It's so important for your health. And in India, that's what they say about yogurt. You need to have yogurt with your dinner because it's so important for your health. And in Korea, I talked to one of my Korean friends. They're like, kimchi, this is a health food. You need to have kimchi every single day.
I
So it's
love it.
interesting, right? Like all of these many generations of wisdom that are distilled into culinary traditions around the world, but they have this common theme running through them of different foods that are considered healthy. So I thought that was fascinating
It
about
is
fermented foods.
fascinating. So I'm Polish and sauerkraut
Ah,
is our staple food. Are you kidding me? I love
mhm.
everything with sauerkraut. But same thing is in regards to that education being passed through generations of how
Yeah.
good it is for you. And maybe we really didn't know the why back
Right.
then. And we just knew that it just made us healthier in some way,
Right.
and here we are having the answer. So I know there's a lot of discussion about strains, different
Yes.
strains of probiotics, and
Yes.
I think that is kind of like the next generation of what we're taking a deep dive into to treating disease states.
That's right.
And I know there's certain strains that do help with atopic dermatitis, certain strains that do help with acne. And I have been firsthand in regards to recommending certain strains to my patients, and they have done better. Again, a synergistic approach with good skincare, lifestyle,
Right.
all of that, right? But what can you share in regards to these strains and disease states?
Well, I think you're absolutely right about the synergistic
Mhm.
effects of different treatment modalities. And that's why we talk about that holistic approach where you're approaching it from different angles to treat different factors. There was a really good meta analysis that came out in the New England Journal of Medicine, and this was a while ago, probably about 10 years ago. But they looked at multiple different studies that used probiotics and or prebiotics in the treatment of atopic dermatitis. And the meta-analysis overall found that these were helpful in the treatment of atopic dermatitis in adults and children over the age of 1.
Mhm.
So in those two groups, children over the age of 1 and adults, it was found to be beneficial overall. But if you look at the individual study results, what you'll find is that there's a wide variation in who responded to treatment
Mm,
and how well they responded to treatment. So clearly, there's a lot of individual differences in how people respond. The other issue with the meta-analysis that they found was that it was very hard to compare these studies because they used different strains, they used different doses, they
yes,
used different durations of
right.
probiotics, and then they also used different types of prebiotics. So it was all kind of all over the place. But in general, the two that have been studied the most are different strains of lactobacillus and different strains of bifidobacterium. Akkermansia is another one that's becoming more studied. So those are kind of the three that are really intriguing. And it's really difficult for me to pinpoint a particular regimen for a patient or
Absolutely.
that's the hardest part for me. I'm still waiting on research to try to decide which is the best one. And I suspect it really varies. I suspect eventually we will get to the point where we are doing a microbiome analysis on an individual patient, and then that analysis is guiding our recommendations. That's what I suspect right now. I suspect it's not a one size fits all approach, but we don't have the data right now to really, which is why I can definitely recommend dietary approaches to strengthening the gut microbiome. That is, no risk. Well, minimal risk there, depending on what your baseline gut status is. I say minimal risk because if you have something called small intestinal bacterial overgrowth, or if you have gut dysbiosis, it actually can be difficult for you to increase the amount of prebiotics in your diet. Like if you've kind of destroyed your gut, I shouldn't say you have destroyed, that makes it sound like you on purpose went in there and wiped them out.
Right.
But if your gut microbiome has really been damaged for a number of different reasons, whether that's dietary choices or whether that's antibiotics that you've received, if you have a problem with your gut microbiome, you may not be able to process prebiotic foods, let's say, as well. So there is definitely nuance, and this is where consulting with a dietitian, if you have what you suspect is irritable bowel syndrome or gut dysbiosis, that's where consulting with a dietitian would be helpful.
Do you recommend that a lot to your patients to
If I
consult?
see a patient who reports irritable bowel syndrome, I typically will tell them if they haven't already seen a gastroenterologist, that's the first stop.
Right.
You want to make sure this is not something more than just irritable bowel syndrome. So that's the first stop.
Right.
And then after that, to have a dietitian or a nutritionist help you with those dietary changes to slowly start to bring your gut microbiome back into a healthy profile.
Yeah. So I was talking to Dr. Peter Leo about
Yeah.
this, and he of course is very much into recommending certain probiotics for atopic dermatitis patients. And I discussed an article that I read about pregnant women taking pre and probiotics may reduce the risk of their offspring of getting atopic dermatitis if they have atopic dermatitis themselves. What is your take on that?
I think that's really intriguing research. And there was a newer study that came out that showed that benefit, but there have also been older studies that have shown that benefit. And as long as it's probiotics are not without risk, but in general, if it's a healthy individual,
Hmm.
then it's okay. But they have done studies. So, for example, patients with cancer who are very, very sick, perhaps in the end stages, that probiotics can sometimes be dangerous to that group.
Interesting. Interesting. So that was my next question. Is
Yeah.
there any harm and who should be taking pre and probiotics and who should not? Like, how do we distinguish that?
So right now they're pretty widely recommended. So in general, they are considered safe. With a few caveats. So dietary approaches always come first. There's no point in supplementing if you're not building a good foundation of dietary practices.
Absolutely. Yes.
But now, if you're considering adding supplementation on top of that, for most people, that's going to be fine. I will say that if you are immunosuppressed, that you have to be careful. This is a conversation to have with your physician.
Absolutely.
If Yeah, if if you're very ill, as I mentioned, the cancer patients who had a worse outcomes in the group that was treated with probiotics. So,
Very
um,
interesting.
yeah, and then there's been some interesting research on cancer patients with immunotherapy about how probiotics affect them. And in some ways, um, there are concerns that they might interfere with the effects of the immunotherapy. That's very preliminary,
Right.
but
Is atopic dermatitis an autoimmune disease? Can we, I mean, again, I'm reading research that there's not enough data to call it that, but anything that you can give us insight about that? Because I know that we are looking into doing probiotics with these patients, but if they have a autoimmune disease per se, like atopic
yeah.
dermatitis, is that something we should be hesitant on? Like, and I don't know if there is an answer about for that.
Yeah, so that's kind of two separate questions
Right. Sorry.
with no, with this idea that is atopic dermatitis an autoimmune condition, and I personally don't refer to it as an autoimmune condition.
Yeah,
I
I don't
think,
either, but I know
yeah.
some people do.
Yes, some people do. I think of it more as it's multifactorial, and I think this impairment, we have been able to show genetic changes in proteins in the skin barrier.
Right.
And so there's a problem with barrier dysfunction. And then that seems to trigger off this inflammatory cascade where your immune
Right.
system is not responding in the way that you would hope.
Right.
And this is where probiotics and prebiotics or dietary approaches to improve the gut microbiome, that's where that might help train your immune system to not be so jumpy and to react against normal things in our environment. So I don't consider it autoimmune per se, but there's definitely a lot where the immune system is not working the way it should.
Right. So it's like, which is it, right? And I'm looking at research and being, because I do hear people refer it to autoimmune, and I'm like, I don't know if I want to stamp that just yet. Like I'm not there yet, but I think maybe doing more research about that. But the inflammatory response to the immune system and multifactorial disease,
Yeah,
absolutely, right? There's so much going on with just this one disease state, and
there is. There is.
it's a lot to unravel. But
It is.
I appreciate your input on that. And again, people may disagree and people may agree, but I'd love to hear the input from our colleagues in regards to their approach of it. It would be a very interesting conversation. You published a book, Glow, and you published an article about diet and skin barrier. Can you tell me a little bit more about that specifically with the article?
Yes. So I was very intrigued by what do we tell our patients about how do they strengthen their skin barrier? And right now, we traditionally really rely on skin care approaches to help strengthen the skin barrier, meaning very good moisturizers applied on top
Mhm.
of damp skin to help provide a seal, to help prevent moisture from evaporating. But there have been a lot of research studies over the years looking at things like evening primrose oil and borage oil and other interventions to try to strengthen skin barrier function. And I will say that when we went into the literature, it was very interesting. The studies on evening primrose oil and borage oil were not as impressive to me as I had hoped. Um, it's not a slam dunk. Omega-3 fatty acid supplements are kind of intriguing.
Mhm.
Again, not a slam dunk though. Some studies beneficial, others, not showing much of an effect. I think that's still a big. The evening primrose oil and the borage oil were personally, when I looked at the data, were disappointing to me. The omega-3 fatty acids are intriguing, not definitive. Intriguing, but not definitive. I definitely found some of the studies using probiotic supplementation to be more intriguing. Some of the studies with probiotic supplementation really showed nice benefits with transepidermal water loss, with improving those. And then there were studies looking at just foods, that were able to reduce transepidermal water loss. And so I like those as well. And then there's some upcoming supplementation. So there's one L-histidine, an amino acid, that seems to help reduce transepidermal water loss. And when I talk about these studies, we're talking about like a few dozen patients in these studies.
Fair.
So
Right, right. So we need more research for sure.
we do. So the nuance is really important. And I don't think I have enough to be definitive about those. But the dietary approaches where you want to have enough healthy fats in your diet, where you need to think about your gut microbiome, like those particular dietary approaches, I can recommend those for sure. Maybe it's only a few dozen patients in the studies, but risk benefit ratio is fantastic.
Absolutely. And that's what you highlight in your book in regards to the whole foods.
Yes, exactly. Exactly.
Amazing. I love your passion about all of this. And I really think we are just at the beginning of just learning so much more. And what do you feel? What does the future look like in regards to dermatology and the microbiome when treating skin diseases? Where do you feel we're going to be in 10 years?
So my hope would be that we would have more definitive recommendations that we can translate to patient care, meaning I would love to have confidence in the data to be able to say this is a good probiotic supplementation uh, regimen for somebody in your condition. And I will say that, acne is an intriguing disease where if you treat with minocycline and probiotics
Mm.
versus minocycline alone, the outcomes are better. I already mentioned the meta-analyses on treatment for atopic dermatitis with prebiotics and probiotics. There's also been really interesting research about some patients with rosacea being diagnosed with small intestinal bacterial overgrowth. And when you reverse that small intestinal bacterial overgrowth, the rosacea resolves. And in one group, they followed up those patients for 3 years, and every single one of them continued to be in remission from their rosacea.
I love
So
it.
yeah, it was
Oh,
fascinating. So that's something that now I think with all of these conditions, you do have to pay attention to gut symptoms. And what I would like to see is a little bit more specifics where we're doing more gut microbiome analysis. And there are a number of centers around the US now that are starting to do that, even in patients with dermatologic disease, to sort of monitor what happens with the gut microbiome. And can that lead us to have this really personalized,
mm,
tailored recommendations? Right now, I think we're very preliminary and it's all, sort of general recommendations. So that's where I hope we would go, because I suspect there's going to be differences between the different skin diseases and between different individuals.
absolutely. Yeah.
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 So, and like I mentioned, probiotics are not without side effects. In fact, there have been some studies that have shown that if you take antibiotics and if you also take probiotics, that your gut microbiome does not go back to its original state. Like
Really?
the probiotics actually delay recovery of your gut microbiome.
So
Sort of,
interesting.
yeah, like sort of like you're introducing this foreign group of microbes, and it prevents your original microbes from growing back to where they were. So that's something that's concerning.
Wow.
So that's why I'm not as, like everybody should take them. I
Right.
don't know about that. I really want to be very focused and deliberate in finding the right patients, the right skin disease, the right strain, the right dosage, the right duration.
Right. This was so incredibly insightful. I
Thank
I
you.
am so excited that I have met you and got to talk to you about this. And I definitely want to continue the conversation as things come out
Oh, I would
in the
love that.
future. But I want to ask you one more question.
Yeah.
There's a lot of information out there about this. What do you have a resource that you feel providers should go to?
So you're absolutely right. Like it's really overwhelming.
Right.
So right now, so we have published several review articles where we try to keep up with the literature. And within 2 years, our review article, is a little bit out of date because there's so much new information coming out. So I do have a blog on my website with a number of patient handouts where I publish on sort of the background and I include references. But really what I rely on is PubMed, is really scanning the literature to see about the latest the latest developments
Right.
in this area.
Well, I'm
Um,
glad that you have a blog because I feel you are doing all that PubMed research and then providing it us in snippets and the most important
yeah.
things. So I definitely think visiting your website would be a great start for a lot of people.
Oh, thank you very much. And I'm so excited that we had this conversation because one of the things that concerned me the most that made me want to get into this area is that there's so many people out there saying things and it's a vacuum. And if we don't step into that to try to provide some practical information for and not just say we need more research, but try to provide some nuance, some practical advice, our patients are getting, there are going to be other sources that are more than happy to sell them supplements on their website.
I couldn't agree with you more. We have a duty to be out there and to provide our patients reliable resources, reliable information where they could be educated and taking the right path. But most importantly, they should be consulting with their providers.
Yes.
Yes. I couldn't thank you enough for joining me, Dr. Katta. You're just a wealth of information about this, and I am looking forward to continuing our conversation about the microbiome and skin health. Thank you.
Well, thank you for the opportunity.